Ladies and gentlemen, please welcome Mark Addicks, CEO of the Manova Summit.
Thank you. Good evening and welcome to the Armory. We've had a great first day and we tried to top it off with an exquisite evening at the newly refurbished Armory. And it's appropriate for this incredible opening night you're about to experience. I want to start out, before I introduce our first speaker, and just tell you, we're very thankful for Walmart as a founding sponsor who's jumped in very early at this. And really thankful because we knew how impactful they were in health, and we appreciated the true Walmart spirit of how entrepreneurial they were by jumping in and supporting us. I heard several things today that I wanted to share as I kick off our next speaker. One of which is, you heard Sam Cass at lunch. He talked about you are what you eat. And there's nothing more true than that. I'm a guy that worked at General Mills for 30 years. And you are what you eat. It will determine your health. And I don't think it should be lost on anybody that what you were experiencing at lunch was an organic lunch, very similar, exactly similar to what we can buy at Walmart today that they're launching. That's what you had today at lunch. And in the true spirit of Manova, one of our themes, accessibility and affordability, I think it's a real salute to Walmart that they are pushing out and making sure that everyone in America and beyond has a choice of the type of food that they eat, and they are what they eat. So we thank them for that. We're going to have opening statements tonight, and then you have an incredible opening night program with the Mayo Clinic, which I'll talk about in a minute. But our first speaker is Lisa Woods. We've heard today from Lori Fleece about the impact that Walmart can have on the health of our country. And one of the really incredible things that I had at the very end as racing away from the convention center, coming to the Armory, is I had someone stop me with a Manova badge and they said, I loved the presentations today. I really loved the woman from Walmart. I said, Lori Fleece. They were like, yes. And they said, I love the fact that she's talking about improving the health of every American. Every American, not elite Americans, but every American. And that she ended with, save money, live better, which is their tagline. But she said, for the first time, I really understood what they mean. I thought that was powerful. And I thought today we had a lot of powerful presentations. We wanted to have a welcoming address tonight before we move to Mayo, which has had an incredible month with the Ken Burns documentary, Changing of a CEO. And we have three incredible people that you're going to hear from tonight and a great panel that's so appropriate for the first year of Manova, and we're thankful for that. But to kick off tonight, as you're served your salad, we're going to have Lisa Woods, who's head of U.S. Healthcare for Walmart. And I really don't have to go any further because what Walmart will do will have major impact on every American family as we move forward, whether they treat them directly or they set a standard that a lot of other retail follows. So please welcome Lisa Woods.
So I've heard that today has been absolutely fantastic, and I hope you all have had a wonderful day. I'm here to talk to you about our associate benefits, and I have the privilege of managing healthcare benefits for over 1 million participants that are enrolled in one of our plans. At Walmart, we spend a significant amount of time thinking about appropriateness of care. So there should be slides. Can you guys, there we go, all right. So we spend a significant amount of time talking about appropriateness of care. And what that means to us is that our associates are getting the right diagnosis and the right treatment plan. And then we talk about quality of care. And that means when they get the right diagnosis and the right treatment plan, the procedures and the surgeries are performed at the highest level of quality. We hear nationally that up to 30% of individuals receive the wrong diagnosis or the wrong treatment plan. And that's why we focus on this. How do we make sure that our associates aren't overtreated? And how do we make sure that they are not undertreated? We know that we have associates that should be receiving care that they don't receive. And we believe that if we take appropriateness of care and quality, we should see our costs and trend impacted, and they should come down. So I wanted to share a couple things with you as far as our continued focus and the tactics and things that we feel are important. These are just a few items. The reality is no one knows what works, but if we don't try, we're never gonna know. And so we have tried to deploy many different programs so that we can try and figure this out. Wal-Mart is very willing to share everything that we learn with others, and we do. We know that what works in one market may not work in another. When we hear healthcare is local, that's absolutely true. We know that each community is different, and providers are all at different places as they evolve in their healthcare journey. Our goal is to be agile and to work with them as they continue to evolve. And then last, access to the right care. Because of our footprint and where our stores are, we're very rural, and there are gaps in care. And our goal is to make sure that our associates have access to the care that they need to receive. And so that is another focus. What we do each and every day is our focus has been to positively impact the healthcare space. Okay. What we know is that we've got challenges. And what I would say is that we are very thankful and very appreciative to every health system, to every provider that provides care for our associates. Unfortunately, as we look at the data, we know that there's some providers that still struggle, and they're struggling in this journey to improve in healthcare. The healthcare infrastructure, we still have fee-for-service, and Wal-Mart's been very committed to payment reform and making changes related to payment reform. We need to do this as an industry because we have perverse incentives that are in place with the fee-for-service. The volume of things that we're trying to consider, there are so many great new co's, new companies, great ideas that come and hit our door, and we're trying to evaluate and figure out how do we manage and ensure that we pick the right programs for our associates. The advancements in technology within the medical field is also another consideration that we are trying to consider. The reality is, we think about if we build it and we put these programs together, are our associates going to use it, and will they come? And so as part of our pilots and the things that we're pulling together and pulling these programs together, we will share that with you as well as time goes on. Okay. I'm having a challenge with the slides tonight. There we go. So Wal-Mart's healthcare portfolio, I thought I'd share a few things with you as far as what we're focused on and the things that we are piloting. We have engaged in public and private collaborations, mainly in the state of Arkansas, but we have a few public programs in a couple of other states. We have built narrow networks. They are in different portions or regions within the country. They are focused on quality first, and then cost. We have 6 direct contracts with ACOs, and we have contracted with a TPA to manage the claims for those ACOs. We have carrier-led ACOs as well, 3 of those, and then we have our Centers of Excellence programs that you heard briefly about today. We also have put in place second opinion programs. We have telehealth. We have care management and healthcare advisors, just to name a few other programs. But I was hoping to really focus on Centers of Excellence tonight to share some information with you. One key point that I wanted to make tonight is I want to make sure that everyone is aware we went into this focused on quality. It's never been about deeper discounts. It's never been about cost. Although I will tell you, we felt that we would see downstream savings if quality care was provided. From a plan design perspective, we created an incentive by paying 100% of the evaluation as well as procedures and surgeries for our associates that would go to a Centers of Excellence. We pay for their travel, we pay for their lodging and their food. For the associate or the patient and one caregiver, we require a caregiver to go. We focus on high-quality facilities, and these are facilities that have lower complications, have lower infection rates, that have low readmissions. And these are systems that have a very low number of unnecessary surgeries, so their appropriateness is very key in how they manage healthcare. As I said, we're focused on payment reform. We've negotiated prospective bundled arrangements, and we have warranties that come with these arrangements. One thing I want to note here is the navigators that are at all of our Centers of Excellence. This is a key part of our program. These navigators meet our associates at the airport. They may meet them at the hospital, but they are there for the patient as well as the caregiver to answer questions. They give the caregivers and the patient care packages, iPads, all kinds of things to help them in their journey during the time that they are at the Centers of Excellence. Our goal with this whole program is to provide transparency to our associates, because we want to make sure that they understand and know where some of the best health systems are where they can get care. And it is to provide care that they may not have available within their local areas or communities. It's been an evolution. We've expanded our Centers of Excellence program over the last 5 years, and it's been a journey. What I'd like to talk about is let's start 21 years ago when we partnered with Mayo Clinic to implement a transplant program. We required our associates to go to Mayo Clinic if they needed a transplant, except for kidneys. I guess at that time you could say we had developed our own Centers of Excellence program. We just didn't realize it at the time. We have sent well over 1,000 associates to Mayo Clinic for transplants through the years. Mayo Clinic has been so good to respond. Some of these cases are within 24 and 48 hours where they need a transplant. They have been true partners here. And our experiences have been interesting. So a couple stories. We had a gentleman that was told that he needed a heart transplant. We sent him to Mayo Clinic, and what they determined is that he needed his medication adjusted, and he ended up not needing a heart transplant. We had another associate who had a child that was told that they needed a liver transplant. Mayo stayed by her side, they monitored her, they allowed her body to heal, and the end result was that the child did not need a liver transplant. In 2012, we started looking at our data, and what we started to see is variations in procedures, variations in cost, and it was for things where evidence-based medicine had been fairly standardized. And so we took the key learnings and the experiences that we saw from the transplant program, and we implemented in 2013 spine and heart. We then implemented in 2014 hip and knee replacements. In 2015, we again approached Mayo Clinic and asked, in partnership, how can we develop a Centers of Excellence program specifically focused on breast, lung, and colorectal cancer? And what we came up with was a medical review program where Mayo Clinic reviews the medical records, we send them the pathology slides, and then they recommend the individual to travel. We do not want these individuals to travel unnecessarily. I'm going to go through some statistics here in a few minutes, but the number of associates that are recommended to travel is about a third. In 2016, we added weight loss surgeries to our Centers of Excellence. And then in 2017, we decided to change our design. And it was based on the data that we started seeing. For spine specifically, we decided we're going to continue to pay 100%, but we're strongly encouraging you to go to a Centers of Excellence network healthcare system. If you choose not to, then the benefit would be at 50% and out-of-network benefit. In 2018, we created the same design for hip and knee replacements. So what do we know? We keep hearing about 30%, 30%, 30% waste in the system. I mentioned about diagnosis and treatment plans. And so here's what we know about our plan. Lori earlier today mentioned that associates that go to their communities and they're told that they need spine surgery, when they go to a Centers of Excellence, they are told that there is another option of care instead of having a surgery. We know that readmissions within 30 days are 95% less at a Centers of Excellence. And the return to work rates are almost 3 weeks less when they get treatment at a Centers of Excellence facility. Joints, 20%. When they go to the Centers of Excellence, surgery is not recommended. The readmissions within 30 days are 70% less at a Centers of Excellence. And let's circle back to cancer. So after we send 1/3 of the associates to Mayo Clinic, 55% get a new treatment plan or an adjusted treatment plan. And 10%, over 10% of the time, it's a new diagnosis. For example, we have an associate that was told that she had breast cancer, and when she went to Mayo Clinic, they told her that she did not have breast cancer. We had a gentleman that was diagnosed with relapsed colon cancer, and he was told by his local facilities that there were no options and that he only had a couple weeks to live. We sent him to Mayo Clinic, and this gentleman had surgery. He had a few treatments, and he is now planning for his future. This is why we do what we're doing. I have a video that I wanted to share with you. It's of one of our associate spouses, and it really talks about the Wal-Mart program.
I'm Penny, and I live in Loveland, Colorado.
I'm Daryl. I'm Penny's husband. I've worked for Wal-Mart for 23 years.
My name's Mary Casala. I'm a registered nurse. I'm part of the Wal-Mart team with United Healthcare. I work with Wal-Mart associates and their dependents who have a diagnosis of cancer. My goal is to help them understand their diagnosis and get the best care possible. The first time I talked to Penny, she was not in good health. In addition to breast cancer, she also had multiple sclerosis. She was suffering from hypertension. She was in a wheelchair. She was frustrated. She was trying very hard and not getting what she needed. She just felt lost in the system and didn't know the steps to take.
She's really helped me through my medications, doctors, the surgery I had to have, even get up there to the Mayo Clinic to even have that surgery. I mean, And she helped me get there, because otherwise I didn't know about that program.
When Walmart introduced the Mayo Travel Review Program for cancer, I immediately thought of Penny. And through this program, she's able to travel with her husband to Mayo and get a thorough evaluation.
Yes, the Mayo Clinic in Rochester. That's been amazing. Of all the doctors I saw up there, lung doctors, heart doctors, cancer doctors, surgery doctors, plastic surgery doctors, all of them, and all in 1 week's time.
Well, first and foremost, Mayo was able to let Penny know that her cancer had not come back, and they were able to work through her unique side effects and has noticed an improvement, and she'll continue to work with the Mayo physicians through the resolution of that. Her blood pressure's improved, her cholesterol's improved, her breathing's easier. She's no longer in a wheelchair. In fact, she is walking 1.5 miles every day. I've seen Penny become a stronger person. Her depression is lifted. She has hope. She has belief in herself. She was nervous when she first was about to embark on the journey, but came back full of hope and inspiration and really believed that she could become better.
But I haven't been in the hospital now since 2 years ago. I really do thank Wal-Mart for this program. It's been a wonderful program. I don't know how to really thank them without just saying thanks.
This is why we do what we do. We're so appreciative of the care that Mayo Clinic has delivered to our associates through the years, and we have so many good partners with different health systems in our centers of excellence, our ACOs, and we so very much thank them as we go through this journey. So what's next? When our associates go to a centers of excellence, they say to us, I didn't know that healthcare could look like that. How can you change the healthcare in our community with the providers and the health systems so it looks like that? So what I can commit to you today is that we are going to continue to focus on appropriateness of care and the quality of care that our associates receive. We are going to continue to work with providers as we go along this journey. And our hope is that as we change care in the communities and as providers evolve, that we can change to where they see that kind of health care. Thank you very much. Enjoy your dinner.